Okay, good morning, everyone. Thank you for attending our Medicare Supplement webinar. My name is Christy Biddy. I will be your presenter today. I'm the Vice President of Health Insurance Services with the Georgia Dental Association, and I have over 30 years experience in the health insurance industry. We will have questions at the end of the presentation. So if you would like to ask a question, you can just raise your hand at the bottom of the presentation, type in your question, and I'll be more than happy to answer those at the end of the presentation. But hopefully most of your questions will be answered throughout the webinar. You are always more than welcome to call me or email me directly. I'm more than happy to help. And my contact, Scott, next slide, please. My contact information is right there, christy@gadental.org or 770-395-0224. My direct extension is 113. All right, next slide. What our agenda is today, we will discuss enrolling in Medicare, when you can do it, how to do it, what the parts of Medicare are. There's Medicare Part A, which is hospital coverage, Medicare Part B, which is your medical coverage, which is basically anything done outside of the hospital, like testing or doctor visits. There is also Medicare Part D, which covers your prescription drugs. We'll briefly touch on Medicare Advantage plans, which sometimes is called Medicare Part C. And then we'll go over Medicare supplements, and those are sometimes called Medigap coverage. And just so you know, the webinar is being recorded today. We will have it posted on our website, so you can always come back and look at it later at your convenience. Next slide. All right, enrolling in Medicare, how do you do that? The easiest way to enroll in Medicare is going to medicare.gov. People have told me when they originally enroll in it that most of the time it only takes them 10 or 15 minutes. You're not really having to make any choices or anything. It's just entering your information in there. So it's a pretty painless process. Now, the initial enrollment period when you're turning 65 is 3 months before you turn 65. The month you turn 65 and 3 months after, regardless of when your birthday falls within that month, your Medicare coverage would be effective on the first of that month. There is the open enrollment period for Medicare, which we're inundated with advertisements on TV during that time, so it's kind of hard to miss. But it's always October 15th through December 7th every year. So if you do not enroll in your during your initial enrollment period, you do not have a special enrollment period. That would be the time during the open enrollment period in which you can enroll in Medicare. Now, the thing to note about original Medicare, there is no provider network. The Medicare does not go out and contract with doctors and hospitals and other providers on reimbursement rates, and that actually helps to keep the Medicare costs lower. They have published reimbursement rates based on county or zip code or procedure, and the doctors know that, the hospitals know that, and they either accept Medicare or they don't. So with original Medicare, there is no website or a place where you can go and look to see if a doctor is in network, because there is no network. The best thing to do is just call a provider and just ask their insurance or billing department if they accept Medicare. Next slide. Okay, Medicare Part A. Medicare Part A is the hospital coverage for inpatient hospital services. It is inpatient care in a hospital or a skilled nursing facility, but it does not cover custodial or long-term care. It also covers hospice and some home health services. Now, with Medicare Part A, there is no premium. It is free, no cost to you whatsoever. There is a deductible for Medicare Part A, and for 2021, that deductible is $1,484. That deductible generally does go up every year, but not usually by tremendous amounts, but it does go up. Now, the thing really to note on Medicare Part A is that deductible is per benefit period, and a benefit period is only every 60 days. So someone who has to be admitted to the hospital 2 or 3 times a year and they're more than 60 days apart, they would end up having to pay that deductible each time that they're admitted to the hospital. So not only do you have the deductible on the Part A coverage, you also have coinsurance, which is generally 20% that you would be responsible for, and there is no out-of-pocket maximum with Medicare. So those charges could definitely add up to quite a bit. Next slide. Now on Medicare Part B is medical coverage. Like I said before, it covers the cost for doctor services, outpatient hospital care, some home health care services, as well as lab testing and durable medical equipment. It covers most preventive services, including an annual wellness exam. Now, on Medicare Part B, there is a premium that you would be responsible for in paying. It is based on your adjusted gross income reported on your tax return from 2 years ago. So for 2021, that premium would be based on your 2019 tax return. And if you look in the chart over there to the right, you will see there is 6 brackets. And it is based on whether you file an individual tax return or a joint tax return, and whether you file married or separate. The minimum that you would pay for Medicare Part B, and for individuals, that is if the income is $88,000 or less. If you're a joint tax return, $176,000 or less, and that monthly premium would be $148.50. There are 4 brackets in between there until you get up to the maximum for $500,000 for an individual, $750,000 for filing a joint tax return, and the maximum premium is $504.90. Now, the thing to note about this, Medicare should automatically go back each year and look at your tax return from 2 years ago, because a lot of people, when they go on Medicare when they're 65, a lot of people are still working at that point, their income's higher. So you will not have to pay that higher premium when you originally enroll in Medicare forevermore. As your income, as you start working less, as your income goes down, that premium should be adjusted every year. Now, for 2021, the deductible on Medicare Part B is $203. And again, just like there's usually an increase on the deductible for Part A, there is usually an increase in the deductible for Part B, but Part B increases are generally very, very low. The 2020 Part B deductible was $198 and it went up to $203. So it went up $5. So those increases are generally very low. Besides the deductible, you also have out-of-pocket for coinsurance, which is generally 20%, and excess charges. Excess charges are above and beyond what the agreed upon Medicare amount, the Medicare reimbursement amount that the providers are allowed to bill you for, that you would end up having to be responsible for and having to pay. And again, there is no out-of-pocket maximum for that. So those charges could add up to quite a bit. So the premium is paid one of 2 ways. If you're collecting Social Security, that premium will automatically be taken out of your Social Security payment each month. Or if you're not collecting Social Security, they will directly bill you. And I believe they bill you quarterly for that, but you would receive a bill and you would just have to pay that directly to Medicare. All right, next slide. The third part to Medicare is Medicare Part D, which is a standalone prescription drug plan. You get no drug coverage through Medicare Part A or Part B, except when you're actually admitted to the hospital and they're giving you drugs while you're in the hospital. That would be covered under your Medicare Part A coverage. But for any drugs that are maintenance drugs that you take on a regular basis, or any kind of one-off drugs that you have to take for a period of time, the only coverage you would get is through a Medicare Part D standalone plan. It helps pay for many brand name and generic prescribed drugs. And it often, according to which plan you enroll in, gives you access to mail order options and retail drugstores across the country. Now, when enrolling in a drug plan, what I recommend doing is if you have a retail pharmacist that is willing to give you a recommendation, you can always talk to them. Some are willing to do that, some are not. The other thing is when you get ready to enroll, if you enroll directly through Medicare.gov, the same website where you can enroll in Medicare Part A and Part B, there is and if you look off to the right-hand side, there is a copy of the website right there. You'll see it says Drug Coverage Part D. If you click on it, and then click on how to get prescription drug coverage, and then just read through the pages and follow the prompts, and you will actually be able to enroll in a drug plan right there. The reason I recommend doing it directly from there is because it will ask you to enter any maintenance drugs that you are currently on. And once you put those in, it will bring up all the carriers and all the plans that cover those drugs and also give you the premium right there. So it's kind of a one-stop shopping. You can click on whichever plan you want to enroll in and directly enroll that carrier right through Medicare.gov. The other thing, if you're interested, this is a new program that we've just started with our broker. It's called Mylo, M-Y-L-O. And I'm sorry, I don't have the information up there because it's a brand new program that we just started. They are actually able to do a comparison between the Medicare drug plans and the formularies that you're currently on with Anthem. And they can do a comparison right there and kind of help you with choosing a drug plan. Now, the thing to know about drug plans is that I have some people tell me when I'm not on any maintenance drugs, I don't take any drugs, so I'm not going to enroll in a drug plan right now. I do not recommend doing that. The reason being, you can only go a maximum of 63 days without credible drug coverage before enrolling in a drug plan. And then they would charge you a 1% penalty for every month you go without credible drug coverage. So say someone doesn't enroll when they enroll in Medicare, they go 24 months, 2 years without enrolling in a drug plan, then want to enroll, they would end up having to pay a 24% penalty on their premium. And that's not a one-time penalty. That's a penalty for as long as you're enrolled in a drug plan. So even if you're not on maintenance drugs, I do recommend just going ahead and enrolling in so you have the coverage. Just get the cheapest plan out there, and you can change your drug plans. You can change the plan and or the carrier one time every year during the Medicare open enrollment period. So say like your drugs change for whatever reason, you don't like the carrier you with, you can change that every year between October 15th and December 7th, which is the Medicare open enrollment period. Next slide. Now, touch just a little bit on Medicare Advantage plans. We are not licensed to do the Medicare Advantage plans. We're just licensed to do the Medicare supplements. And sometimes you'll hear Medicare Advantage plans are also called Medicare Part C. Now, Medicare Advantage plan will generally encompass your Medicare Part A, Part B, and a lot of them also include your drug plan. Most of the Medicare Advantage plans do have a provider network. Most of them are HMOs. You can find some PPO plans in there, but there is definitely a provider network. There is the possibility that you will get lower premiums than over a Medicare supplement, but your benefits are not going to be as comprehensive with a Medicare Advantage plan as they are with original Medicare and a Medicare supplement. You could have co-pays when you go to the doctor. Medicare Advantage plans really are more like your typical health insurance, where when you go to the doctor, you're going to have a copay, you're going to have deductibles, and you can have maximum out of pocket, $6,000, $10,000, but your maximum out of pocket could be quite a bit with a Medicare Advantage plan. They are provided by private health insurance companies like United, Anthem, Aetna, Cigna. You're going to find several out there, but they are provided by private health insurance companies. So the plans are going to vary from carrier to carrier. It's going to be, like I said, more like your typical health insurance, where you're going to have more decisions to make on what you want your deductible to be, what you want your copays to be, what you want your co-insurance and your maximum amount of pockets to be. So there are going to be more choices to make with a Medicare Advantage plan. And it does require annual enrollment every year during that Medicare open enrollment period. Next slide. Okay, now what we can help you with is a Medicare supplement, or sometimes they are called Medigap plans. The premium is based on the county you live in, whether you use tobacco products or not within the past 12 months, your gender, and your age. Now, if you look over to the chart on the right, and I'm sorry, for some reason that chart, oh, there we go. You'll see that chart right there. And those are the 4 plans that we offer, that the GDA currently offers through Anthem: Plan A, Plan F, Plan G, and Plan N. Now, looking at the chart, you will see that someone in Area 1, areas are based on the county. So Area 1 is generally your more metropolitan area, like Fulton County, Gwinnett, DeKalb, Cobb, Rockdale. Those are more your, you're going to pay a little higher premium because the cost for medical services are higher in those areas. Area 2 are your more suburban or rural areas. So your premium is going to be a little bit less. But if you look on there, Plan G, and I will go over Plan G, Plan F in just a minute. The premiums are pretty cheap. The monthly premiums are not that high. Now, on Plan F is the Cadillac plan of Medicare supplements. The thing to know about Plan F, however, is that you cannot enroll in Plan F unless you were eligible for Medicare prior to January 1 of 2020. Anyone newly eligible after January 1, 2020 cannot enroll in Plan F. Plan G is the next best plan under that, and that is the one that I really recommend anyway. With Plan F, and you'll see on the chart when we go to the next page, I want to stay on this page for just a second. With Plan F, it's going to cover everything that is a covered expense under Medicare that Medicare does not pay. So therefore, it's going to pay your Medicare Part A and Part B deductibles. It's going to pay both of those co-insurances. It's going to pay your excess charges. You would have no out-of-pocket by enrolling in Plan F. Now, the reason I recommend enrolling in Plan G, with Plan G, the only thing that does not cover that Plan F does is the Part B deductible. And again, the Part B deductible for 2021 is just $203. And if you look at a male in Area 1 who is 65, the difference between Plan F and Plan G is $70 a month. That's over $800 a year in premium that you would be paying to get a $200 benefit. So it really just doesn't make sense with the extra costs that it would cost you in premium just for that $200 benefit. So that is why I recommend going with Plan G with an Anthem Medicare supplement. And every time that I point that out, the premium difference and the benefit difference in those 2 plans, everyone has gone with Plan G. Now, the thing to know about Medicare supplements also, they are individual policies. They are not group policies. They are individual. So the premiums are paid directly to the carrier. They will bill you for it and you will pay them directly. You can set up how you want to be billed. You can be billed monthly, you can be billed quarterly, you can even pay the whole year up front. They do get billing discounts if you set it up to auto debit out of your account, and they even give you a discount if you pay for the whole year up front. And then they also give what is called a household discount. If you have more than one person living in the same household, you don't even have to be related, you could be roommates, and both of you are enrolled in an Anthem Medicare supplement, both of you would receive a 5% discount off of your monthly premium. So next slide. So here is the chart that goes over what each plan covers. And then again, if you look at Plan F, and you'll see right above the chart, it says Medicare first eligible for 2020 only. If you go down the Plan F column and the Plan G column, the only box that is checked in Plan F is that Part B deductible. That's it. Other than that, Plan G is going to cover everything that Plan F does. It's very extensive coverage. For example, say it's a covered, say someone has to go into the hospital and it is a covered expense under Medicare, knee surgery. All the providers accept Medicare, the hospital, the anesthesiologist, the surgeon, everyone accepts Medicare. And they have original Medicare with Medicare with Anthem Supplement or Anthem Supplement Plan G. Their out of pocket for that surgery total is going to be $203 in 2021, and that is the Part B deductible. Other than that, everything will be covered. And if you notice, I said if it's a covered expense under Medicare, if Medicare does not cover it, your supplement is not going to cover it. It has to be a covered expense under Medicare for your supplement to pay also. For example, voluntary cosmetic surgery, Medicare is not going to cover that, and therefore your Medicare supplement will not pay anything either. All right, next slide. I'm sorry, back one. Oh, I'm so sorry. There's a slide missing in there. I just wanted to go over some points in there about the Medicare supplement. Supplements, the Medicare supplement supplements Medicare Part A and Part B. It does not supplement your drug coverage. Again, the only drug coverage that you're going to get is through your Part D drug coverage. You have to choose who your carrier is, whether you want Anthem or United or Cigna. There are tons of companies out there, health insurance carriers that offer supplements. But the thing to note about Medicare supplements are that they are the same regardless of who the carrier is. Regardless if it's Anthem or United or Cigna, a Plan G is going to cover the exact same thing with all of them. And the reason being they're federally mandated on what they have to cover. So there is going to be no difference in the coverage whatsoever. The differences, of course, are going to be your premiums because carriers get to determine the premium. But the thing to note is that all the premiums between the carriers are pretty comparable, because if one carrier charged a tremendous amount more in monthly premium than the other ones did, the other carriers, no one would ever enroll with them. So they're all pretty comparable on what the premiums are. The other thing is the extras that you can get with it. Like I said, you can get billing discounts with Anthem through their Medicare supplements. If you do auto debit, pay the whole year up front. You have a household discount. And also with Anthem, who is the carrier that we use for our Medicare supplements, you automatically get enrollment in their Silver Sneakers program, which is a gym membership, a free gym membership. And at last count, there were over 15,000 different gyms that participated in that program. The other thing to note about a Medicare supplement, it is guaranteed issue if you enroll in it within 6 months of your Part B effective date. So if your Part B effective date is, say, March 1st, and as long as you enroll in your Medicare supplement by September 1st, you're guaranteed issue, meaning you do not have to answer the health history questions. You do not have to go through underwriting. They cannot turn you down. They have to enroll you in it. If you go beyond that 6-month period from your Part B effective date, you would have to go through underwriting, and they can turn you down for your Medicare supplement. And as we were going through before with the deductibles and the co-insurance and the excess charges, and there being no out-of-pocket maximum, your cost without a Medicare supplement could get quite high. So definitely, if you enroll in original Medicare, you definitely want to get your Medicare supplement within 6 months of that being effective. Also with a Medicare supplement, it is auto renewable every year. Once you're in there, you're in there. You do not have to contact the insurance company. They will not send you anything asking if you want to auto renew it for the next year. It just continues on. The only reason the carrier would ever cancel your coverage is for non-payment. So once you're in there and don't even have to worry about it. Now, the thing is, there is no open enrollment period for a Medicare supplement. It is an individual policy. You can change that plan anytime you want to. Say like you want to go with a different carrier, you enroll with United and then you want to switch over to Anthem. And the thing to note about that is if you do it beyond 6 months of your Medicare Part B being effective, again, you would have to go through underwriting and they can turn you down. So if you do end up wanting to change or try to change, don't cancel your current Medicare supplement policy until you get confirmation from the new one that you're accepted and they have enrolled you. If you go ahead and cancel your first policy, you get declined on the new one, then you're going to end up being without a Medicare supplement policy. But again, the thing to note, you can try and change if you want to, but the majority of people do stay with the Medicare supplement that they go with when they originally enroll in Medicare, so they don't have to worry about going through underwriting and being denied. Now, also with the Medicare supplement, you have to have enrolled in Medicare Part A and Part B and have received your Medicare ID number prior to enrolling in the Medicare supplement. Your Medicare ID number and effective date is required on Medicare supplement applications. The reason being, the carrier links your Medicare supplement to your Medicare ID number. So just remember, you do have to enroll in Medicare first, have received your Medicare ID number, then you can enroll in the Medicare supplement. Last thing to note, well, a couple of things to note also to note about Medicare supplements. You do have to enroll in the Medicare supplement plan in the state of legal residence. So of course, if you're in Georgia, I can absolutely help you out with that. But if you're enrolled in, if you're legal residents in South Carolina, Florida, Alabama, unfortunately, we would not be able to help you with that, but you can always contact the carrier directly and they can enroll you. Now, the thing, if you decide to enroll in the state of Georgia directly with the carrier, you would not have an agent of record. If there are any issues that ever arise, you would have to deal directly with the carrier on your own. If you go through an agent, you would have an agent of record. And if there are ever any issues, they would be able to help you with those. The thing to really note about that is there is no difference in the premium, whether you enroll directly or go through an agent. The premium is exactly the same. So it definitely is a benefit to go through an agent in enrolling in a Medicare supplement. They would be your advocate and, like I said, can help you with any issues that come up. And the last thing is, since Medicare supplements are individual policies, it is not a group policy. You do not have to be a member of the GDA or remain a member of the GDA in order to enroll in a Medicare supplement through us. I could help your neighbor or any friends that you have enroll in a Medicare supplement also, because again, it is an individual policy, not a group policy. All right, so that is the end of the webinar presentation. My contact information is right there, Christy. Phone number, my direct extension is 113, or you're welcome to email me at christy@gadental.org. We, like I said at the beginning, we are recording the presentation, so it will be posted on our website at gdaplus.com/Medicare. Also, if you go over to our website, we have an Anthem Medicare supplement booklet, which gives a lot of the information I covered in the webinar today. Also has the rates in there. It has the chart on what each one of the Medicare supplement plan covers. And then we also have the Medicare supplement application listed right there on our website. Also, if you wanted to go over there and take a look at it.